Hi, I'm Dr. Janet Pope, a reporter at Room Now, and I'd like you to follow us while we're covering EULAR 2021 meeting. I'd like to talk about vitamin D and is it an inexpensive disease modifying drug? So there was a nice poster 0100, that looked at patients with their vitamin D level who were starting an advanced therapy. And about 60% almost were starting a TNF inhibitor, and the rest were starting other bio-DMARDs. And they looked at whether your vitamin D prior to starting your advanced therapy, whether it was normal or low. And certainly in many hemispheres, when we don't have the sunshine, if we're not near the equator, we often have ourselves and our patients with low vitamin D. So what they found was the proportion of patients getting into EULAR good state or EULAR remission was far higher, about 4 times higher, if you had a replete or normal vitamin D than if you had a low vitamin D. Then they did some statistics and adjusted for things, and they found that DAS ESR remission was again statistically significantly higher if you had a normal vitamin D than a low vitamin D. Now, when they looked at other features such as related to CRP or related to CDI or SDI, it wasn't statistically significant. However, vitamin D is inexpensive. I don't even know if we have to do vitamin D levels because you can assume, especially after winter, but even year round in many countries, you can assume your patient is likely to be low in vitamin D. And if they have normal kidney function, normal liver function, then you can give them vitamin D and you're not going to hurt them if they don't need it anyway. Then the next question that I would ask, and there's a lot of data, some presented at EULAR and actually presented already in publications, is that patients have very poor outcome if their vitamin D is low relative to if it's normal. So with that in mind, if it could affect COVID outcomes, and maybe if it's got immunomodulatory effects on our patients with RA, enhancing response to disease modifying drugs, why not just give vitamin D to everybody? And this probably will change my practice where I'm more apt to say to a patient, please, what are you on as vitamins? Get adequate calcium in your diet, about 1 gram a day by 2 dietary sources of calcium-rich foods should do it. But let's give you vitamin D as well. How much vitamin D? I don't know, but maybe a couple thousand units a day. So stay tuned for other At Room Now talks. Thank you.